session. It's a very similar session to what we had yesterday, where we had the group discussions. And we are carrying on from where we stopped. So wherever you stopped yesterday, please carry on. The focus today is slightly different in the sense that we want to focus more around the health goals that we displayed yesterday. So if you remember, Garrett displayed 7 health goals that we think are the key health goals that countries are trying to achieve in terms of any form of digital health transformation in their country. Whilst a lot of times the transformation is being done at a program level, overall we believe that these health goals are what countries are trying to achieve. Today in particular, we want to focus on 3 health goals. Being able to achieve continuity of care, supply chain, and patient management, supply chain optimization, and trusted personal health records. So those are the 3 health goals we want to focus on. So before I talk about the sheets that you have on your table, they're slightly different from the one from yesterday in terms of the outputs that we're going to be discussing. The architecture template is the same, but the outputs and the discussion for today is just a bit different, but it's building on from yesterday. I will ask for another poll, and just to help us understand, what you think based on what you've heard over the last day and a half around DPIs and achieving these 3 health goals. So the first question we want to ask is, which DPI components do you consider most relevant to achieving continuity of care? So I'll allow you to vote, and we will leave the screen so that you can also see how people are voting. And it's really thinking through what we've heard today, especially around the architecture and technology session, the standards and content session, and thinking about how our speakers elaborated on how we should be thinking in terms of designing and planning our architecture to achieve the health goals. So if you think about continuity of care, which are the DPIs that you believe are the most important to achieve continuity of care, whether it's foundational or health sector specific DPIs? And we'll just give a few seconds for people to vote. And I can see that there seems to be a common theme in terms of what people believe are the core DPIs that are important for achieving continuity of care. Okay, so it's interesting to see, and this should also form part of your conversations in your discussion groups. Chris, can you show the next question? I hope you've finished voting. Which ones do you consider to be most relevant to establishing trusted personal health records? Okay, more interesting votes coming in. And perhaps, if people are still not clear on some of these DPIs and how do we get to being able to achieve these health goals using FHIR and DPIs, these are conversations that you can have on your tables as well. Are we ready to move on to the next question? This is my last poll for you. Which ones do you consider that are critical for supply chain optimization in healthcare? Okay. I think that generally what we can see is that there's a sort of consensus in the room in terms of the DPIs that we consider relevant for each of these health goals, which is good to know and good to see. While that is going on, I will just briefly talk about the sheets that you see on your tables. Very slightly different, like I said, in terms of what we'll be discussing. And today, the focus is really thinking about planning and designing a national architecture for DPIs, with DPIs and FIRE for health. And thinking through what the gaps and the challenges are in countries that would, and whatever learnings there are based on, having discussions with other countries on your table, that would allow you to then plan how you can design your national architecture. So if we think back at Carl Leitner, my colleague's presentation, and how he very nicely articulated all the different things that you have to think about in terms of the business goals that a country might be trying to achieve, as well as the health goals that they're trying to achieve, and thinking through which DPI components are necessary. Now, I bring you back to yesterday where we talked about which are the relevant authorities in the country that are there and present, which policies and standards are available, what governance is in place. And having identified those from yesterday, think about the challenges, the gaps, the learnings, and what can a country be thinking of in doing to move to the next level. So where do you want to be, and thinking through that and being able to articulate that. So just like yesterday, we have some expert facilitators on your table to help guide the discussion. And we also have rapporteurs who will be taking notes and feeding back so that we can learn from it. Yes, and we are keeping the focus on immunization. Thanks, Garrett, for reminding me about that. So if you think about that in the context of immunization, and hence the reason why we provided those specific presentations before now around immunization. So if we move to the next slides, we've developed a couple of prompts, just like yesterday, in terms of discussion prompts, to allow you to think through the different things that you can consider as part of your discussion. But just like yesterday, we found that a lot of people were really engaged and really enjoying the discussion that was happening on the tables. We're just providing prompts for you to think through how you discuss. So if you, like yesterday, I'll move around as well as Garrett and Chris. If you have any questions, please feel free to just call us and we'll provide clarification. And I think that's it for now. I'm around if you need to ask any questions. Thank you. Immunization as the use case, please. Thank you. We'll try and run it for about 50 minutes and 50, and then provide 10 minutes for, same like yesterday, some feedback and questions if people have any. Thank you all.
About the Jordanian ecosystem, so all of you will be familiar with Jordan. The health sector in Jordan is divided into public health sector, military health sector, semi-public, which is educational and facilities like King Hussein Cancer Center, and the private sector. On the other hand, we have insurances, public insurance and private insurance and military insurance as well. For the demographics, we have Jordanians, citizens, Jordanian citizens, and non-Jordanians, which part of them are refugees. In Jordan, if we are looking at the DPIs that we have in Jordan, we have many foundational DPIs, like the digital identity, the trusted network. We have constant yes, constant data sharing, which is related to the digital identity. We have also implementing financial transaction system, which you can transfer money either using your bank accounts, your digital wallets. Even there are some agents that you can pay them cash and they do the payment for you. This is for the foundational registries. For the health DPIs, unfortunately, we have some registries, but they are not mature enough. We are working on a project to assess those, let's say, the digital health sector, and come up with a new architecture. So for sure we will use the architecture that was shared in this summit. And we will come up with a roadmap to implement those DPIs related to the health sector.